student nurse Divine Antimano from BSN 21. For today's storyboard, I'm going to teach you the step-by-step procedure on how to perform Leopold's maneuver. So, what are we waiting for? Let's start! So the first step is to identify the correct patient. Make sure to use two patient identifiers such as patient's name and birthday, or depending on your hospital policy. Step 2 is introduce yourself and state the purpose of the intervention. You may do so by saying, "Hi, I'm Nurse Divine and I will be your nurse from 6 a.m. to 2 p.m. Your doctor ordered for a Leopold's maneuver. This is done to determine the presentation and position of the fetus and aid in location of fetal heart sounds." Before doing the procedure, don't forget to do the hand hygiene. Step 4. Assist client to lie on bed on a dorsal recumbent position. It is a position where a woman lie on her back with her shoulders raised slightly on a pillow and her knees draw up a little. Step 5. Expose the part to be examined, keeping a cover on the other parts. First maneuver, or fundal grip. This answers the question, what lies at the fundus? In fundal grip, we're going to face the client's head. Then, using both hands, palpate the fundal area. Expect to palpate a soft, irregular mass in the upper quadrant of the maternal abdomen. This determines the shape, size, mobility, and consistency of what he or she feels. The lines and the shoulders contain little bone processes that move with the fetus trunk. The head is firm, hard, round, and moves separately from the trunk. And the buttocks is symmetric and feels soft. To determine the fetal back, we're going to use the second maneuver, which is the umbilical grip. While still facing the patient, move hands to the lateral sides of the abdomen. Perform this maneuver by placing the right hand on one side of the patient's abdomen while using the left hand to explore the woman's uterus on the right side. Repeat this step on the opposite side using the opposite hand. The fetal back is smooth and firm. The extremities of the fetus should feel like protrusions and small irregularities. Third maneuver, or Pollock's grip. This answers the question, what is in the inlet? In this step, you're going to move your hands down to the lower pelvic area. Then, palpate the area in just above the symphysis pubis to determine the presenting part. After that, grasp the presenting part with the thumb and fingers of the right hand. This step of the process identifies the part of the fetus that is above the inlet. Pelvic grip, or fourth maneuver, answers, what is the attitude? Good attitude is when the brow corresponds to the side that contain the elbows and knees. Meanwhile, poor attitude if examining fingers will meet an obstructions on the same side as the fetal back. In this step, we're going to place the client's feet. Then, place the hands on the abdomen and point fingers towards the mother's feet. Gently move the fingers on the both hands towards the pubis by sliding the hands over the sides of the patient's uterus. The side where the greatest resistance to the descending fingers is the location of the brow. After that, assist client to get out from bed and keep all materials used. And of course, don't forget to do hand hygiene. And last but not the least, record your findings on the client's record and refer to the attending physician. And that's it for Leopold's maneuver. Hope you guys learned something and goodbye!